Pancreatic cancer is one of the deadliest forms of cancer, and that's why it's so important for you to recognize the first non-specific symptoms. Unfortunately, several risk factors are in your own hands. Pancreatic cancer is one of the most feared types of cancer because the prognosis is often poor despite modern therapy. I have the greatest respect for this tumor type. Pancreatic cancer has one of the lowest survival rates of all cancer types. Only around 10% of all newly diagnosed patients will survive the following 5 years. This is partly due to pancreatic cancer often being discovered late, as the symptoms only appear at an advanced stage. It is vital to recognize the non-specific early symptoms of pancreatic cancer so as to be alerted sooner. In this video, I will discuss these symptoms and other important facts, including possible therapeutic approaches. Hello, my name is Dr. Tobias Wegel. My YouTube channel provides medical education, clearly and correctly explaining diseases and their causes. It also explains how we can prevent this disease by detecting it early. Subscribe to my channel to ensure you never miss any information. Every year, around 20,000 people in Germany develop pancreatic cancer. Although this is a rare form of cancer, we see an increasing trend here, unfortunately. This is partly due to our aging society, but also to risk factors such as smoking, obesity, and alcohol consumption. These are principally also the usual risk factors for cancer. I must point out that unfortunately, pancreatic cancer can often only be determined genetically. Pancreatic cancer in particular is really tragic. First and foremost, you definitely want to learn exactly what pancreatic cancer is and how to recognize it. What is pancreatic cancer? I would like to remind you that we often neglect the role of the pancreas in our daily life. We don't really know its purpose. The pancreas is approximately 15 to 20 centimeters long and is located in the middle of the upper abdominal cavity. It lies behind the stomach and is attached to the posterior abdominal wall. Take note, this is one of the reasons pancreatic cancer is often discovered so late. Due to its location so deep in the abdomen, it can be difficult to detect changes or tumors at an early stage. You cannot see it from the outside, nor can you feel it. The two main tasks of the pancreas include producing digestive juices and releasing them into the small intestine as a digestive aid. And secondly, the pancreas is responsible for producing hormones such as insulin and glucagon, which regulate blood sugar levels, among other things. You may be familiar with insulin and blood sugar levels. You are probably familiar with diseases such as type 1 diabetes, in which the pancreas produces too little insulin because certain cells of the pancreas are destroyed. In 95 out of 100 people affected, digestive enzymes and juices are formed inside the very tissue responsible for their formation. That's exactly where a tumor forms a malignant cell proliferation, which I will cover specifically in this video. These tumors are unfortunately often aggressive and can grow and spread quickly. This means that metastases form in other organs. Some tumors grow slowly and therefore have better treatment prospects, but those rarely appear in the pancreas. Men and women are equally affected and are on average 70 to 75 years old, but I have also seen some in their early 40s. How do I recognize pancreatic cancer? Pancreatic cancer often remains asymptomatic for a long time and only becomes noticeable at an advanced stage. Therefore, there is a reduced chance of recovery. Early detection of cancer is vital, which is why I always emphasize in my videos that screening is so important. I would like to make you aware of certain early non-specific symptoms. It is important to know that these symptoms can also be harbingers of harmless diseases. Nevertheless, these symptoms should always be clarified and treated by your doctor. Early symptoms of pancreatic cancer include persistent pain in the upper abdomen or back, inexplicable nausea, jaundice, and unintentional weight loss, including loss of appetite, which are known as B symptoms. In addition, fatty stools can be typical, where the stool is often lighter than usual and therefore slightly greasy and shiny. If pancreatic cancer continues to grow undetected, as is usually the case, it can also displace the surrounding organs at an advanced stage, or lead to non-specific pain, digestive disorders, and water retention in the abdomen as the tumor grows larger. In extreme cases, this is also referred to as ascites. In addition, the pancreas can also become inflamed for no apparent reason, pancreatitis. You should always seek medical advice if you experience symptoms which last for several weeks. And think about the pancreas. Diagnosis of pancreatic cancer? There is no standardized screening program for pancreatic cancer in Germany which recommends certain examinations for early detection. This type of cancer is often difficult to detect in the early stages due to its location, and current methods do not provide reliable results. It is always a cost-benefit analysis. You have to take into account how much pain is caused and how much effort is put into identifying the few who are affected. Only when you get the complaints I mentioned do you see your doctor, who will perform an anamnesis. The duration of symptoms, possible medications, and lifestyle changes will be discussed in that interview. Your doctor will perform a physical examination, which involves palpating the abdomen to look for possible clues, such as pain in the upper abdomen. Most of the time it involves the stomach. This is followed by an imaging procedure such as CT, MRI, or ultrasound to visualize possible changes in the pancreas or even tumors, which are usually present already. Imaging is the only way to determine whether you have a pancreatic tumor or not. It allows us doctors to get accurate information about the location and extent of the tumor. An important aspect to note is that a blood sample is also taken. If you already have a suspicion, the blood sample is used to obtain a more accurate diagnosis. Then, a tissue sample is also taken to get more information about the type of tumor. Which cells are involved and how malignant is the tumor? Due to the cost-benefit aspect, tissue removal cannot be carried out on a blanket basis for everyone. This invasive procedure involves the use of a needle. Blood samples are vital because there is a tumor marker with a relatively high significance in pancreatic cancer. It's called CA19-9. Even in small tumors under 3 centimeters, half of all patients have an elevated CA19-9. For larger tumors, that increases to 90% of patients. Similar to other tumor markers I have listed, it is also important for the course of the disease. Based on those diagnostic procedures, we will discuss further treatment options which are very individualized in pancreatic cancer. One examines which part of the pancreas is affected and how far the disease has progressed, as operations such as Whipple, for example, are very lengthy and difficult and can have significant side effects. Treatment of pancreatic cancer. Suitable treatment largely depends on your individual disease situation, and you cannot follow set steps as you can with other cancers. It depends on the stage of the disease and your general condition, and whether you can cope with a major operation if you even want one. If the diagnosis is made at an early stage of the disease, which rarely happens in pancreatic cancer, the tumor can be surgically removed with some luck. This is often combined with chemotherapy before and/or after the operation. If the tumor is already too advanced, too large, and affecting other organs, making complete removal impossible, doctors rely on chemotherapy or radiotherapy as well as targeted drug treatments to control tumor growth. The aim is to maintain the quality of life of those affected for as long as possible. For sufferers, the diagnosis and therapy is often a massive psychological burden, so that accompanying psychotherapeutic treatment can really be a great support. I have seen patients in the ICU for several months after such an operation until they finally died, so this psychological aspect should not be underestimated. Those affected often ask themselves the question, why me? Why am I affected? Unfortunately, the causes of pancreatic cancer have not yet been clearly identified. As silly as it sounds, it's often simply bad luck, but there are several risk factors which promote pancreatic cancer. Risk factors for pancreatic cancer. Certain lifestyle habits and diseases increase the risk of pancreatic cancer. It is possible that several of these factors must interact for the development of cancer. Ultimately, these are the factors which increase the risk of cancer in general. Smoking is a confirmed risk factor. Even though we often associate this primarily with lung cancer, pancreatic cancer is also 2 to 3 times more common in smokers than in non-smokers. Passive smokers also face an increased risk. Excessive alcohol consumption and obesity also seem to increase the risk. The same applies to certain pre-existing conditions such as chronic pancreatitis. Type 2 diabetes also affects the pancreas. 5 to 10% of cases seem to have a familial accumulation. In professional circles, this is referred to as familial pancreatic cancer. The role of diet, especially excessive consumption of animal fats, is currently being discussed as a risk factor. And in general, this should be reduced regardless of the risk of pancreatic cancer. Apart from genetics, there are some risk factors that you can act on but without any guarantee. Cessation of smoking, moderate alcohol consumption, a balanced diet, and regular exercise will reduce your personal risk of pancreatic and other cancers. Those specifically remain in your hands. Try to keep your personal risk of cancer as low as possible. If you are worried about this because of your family history, please comment below and we can discuss it. Thank you very much. Keep following me.